On this episode of Africa Health Check.
State of health in Africa, I think, is on a positive way. It's good, but we need some improvement in the kind of equipment we use for certain critical illnesses.
Vituo vya afya viko vingi kwa ajili ya kutoa huduma za afya. Hizo ndo hatua ambazo watu huchukua na serikali yetu inatusaidia katika.
We discuss our continent's health security status.
We need to have tailored programs or initiatives that target the specific problems in the localities.
And highlight the key learnings from the COVID-19 pandemic. Africa has faced numerous health challenges, including infectious diseases, non-communicable diseases, and the devastating impact of the COVID-19 pandemic. It remains a glaring fact that the world's response to the COVID-19 pandemic has exposed the weaknesses and inequalities in the global health ecosystem. On today's episode, we will be discussing Africa health security, lessons from COVID-19. I'm your host, Fogontlejang Paladimorokozo, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Moreithi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. Before we get into that, let us have a look at this episode's feature story.
My name is Austin Gideon Adubasomanani. I'm from Kintampo, but based in Kumasi. at the Kumasi Center for Collaborative Research with the Global Health and Infectious Diseases Research Group as a research fellow and a doctoral candidate. I am a student public health at the Kenya University School of Public Health, and that's varied types of research concerning infectious diseases and global health. I believe that the community should be the center of all the initiatives. So first of all, we need to have tailored programs or initiatives that target the specific problems in the localities. It may be possible that a solution might work in one setting, but when you move it wholesale into another, it doesn't work that way. So we need to adapt and be sure that the solutions are tailor-made to address specific problems. The other thing is collaborative efforts on the part of our partners. It is important that the initiatives that we come up with in terms of food security, in terms of infection prevention, in terms of control of emerging and emerging pathogens are all addressed collaboratively. Each groups have different strengths, and if these strengths are brought together, it would lead to a higher impact on improving the quality of lives of the people in Ghana or in Africa for that matter. The project that I worked on is a rice-based approach to nutrition-sensitive agriculture to improve household food security in the Ahafo region of Ghana. This was a project funded by a grant won in collaboration with the Wageningen Center for Development Innovation. And the objective of the project was to make sure that we are able to link agriculture and nutrition in terms of health to be able to improve household food security. Whilst the food processors are processing the foods that are coming from the agriculture first sector, the nutrition officers are able to encourage the people to also make sure that they are able to utilize these foods to improve health, especially in the vulnerable groups who are usually the under fives and then lactating or pregnant women. Yeah, so health security usually deals with the ability of a nation to, one, prevent, to detect, and then respond to public health threats. And so when you take health security in Africa for one, just like COVID-19, it has always been a challenge. And one of the ways by which we are able to monitor some of the interventions that we put in place is, one, to make sure that you reach out and engage the various stakeholders. The collaboration between research, academia, healthcare, policymakers, and even the private sector would go a long way to strengthen our healthcare system in being able to have the solutions or being prepared enough and having the capacity to respond to the strain that, if such an event comes up, it may have on the healthcare system. And so in proposal writing, I believe that it must be locally relevant. It must also be locally acceptable. It must be adapted to the peculiar situations of whichever community. Because the fact that it worked in community A doesn't necessarily mean that it will work in that format in community B. And so we need to be sensitive to these activities when we writing proposals and implementing our projects, so that we can have sustained development in our communities.
Thank you very much for that. I think our feature story has really very eloquently, very comprehensively sort of defined what health security is and what it entails. I don't know if Dr. Marianne, you have anything you want to add to that?
Yes, thank you, Gigi. Great to be here again. And health security is a very important matter to discuss, because as we've watched and we've listened, that we need to make sure that our security measures put in to protect our health is key. And what are these security measures, or what are we protecting ourselves against? There are many adverse things that can affect a population's health. We can start off with a pandemic, infectious disease. That's something we need a very good public health security Bioterrorism as well is something we need to be cognizant about and have measures to make sure that a country, a population is also safe. We've seen the threats that Ukraine sometimes, and in parts of Eastern Europe, sometimes they have that fear that there may be some bioterrorism attacks.
Yeah.
What biosecurity measures do they put in place? And many others, such as natural disasters, Gigi. Again, we need to have structures that protect the public and offer security when it comes to public health measures. So these are some of the aspects we're talking about. And we're going to talk about how our community is prepared, how we're working together with different organizations, government, non-governmental structures, and other initiatives such as the CDC to make sure that our public is safe and secure.
Absolutely. Thank you so much for that. Just to bring you in here, Reverend, what are some of the factors that can actually jeopardize the health security of a country or a region?
Okay, we're talking about Africa health security. So it is more of a continental, regional, and if that is the case, then the first thing that we think about, if this is going to work, our political leaders need to come together to make policies like Abuja Declaration, where they set themselves targets as to what to do. And they translate this into national policies, and then get the nation to be prepared, national preparedness in each country. We talk about communicable diseases, vaccine acquisition, and how to vaccinate the people, where to go, prepare the communities. But when all these are lacking, that becomes a problem, to guarantee the security of the continent.
Yes.
And maybe I was just going to add on to what else could be missing. And I'm really thinking about health security. And really, when you're looking at that equation, Gigi and Reverend, as much as we're making the policies, political goodwill, and looking out for the well-being of our people, some of the key measures or key deliverables, I think, in all this is to ensure or to check, are we prepared for any of these eventualities? And if we are prepared, are we detecting? Do we have mechanisms to detect that there's a problem? And if we can detect, and then how are we responding? How do we respond to disasters or anything that threatens the public health security? And then once we can respond, detect, and know, how do we plan on recovery? We are now, we are living in
surveillance, diagnostics, response, and then
preventative mechanisms as well to be put in place.
And I think right now we are in a post-COVID recovery phase. So what are we doing? Are we just sitting back and just waiting and saying, "Hey, we survived that"? So all this, whatever we are doing right now, all forms a pillar on what public health security is all about.
And talking about what are we doing, lessons that we have learned from COVID-19 and how we making sure that we utilize them to safeguard our health security and our preventative mechanisms. Maybe you could share some of the things that have been happening at the continental level. I know there have been some initiatives by African Union, Africa CDC, MasterCard Foundation. I don't know if either of you would want to start on that.
Yeah, it's good to bring this in because it is difficult for one country to isolate themselves, to say it's our own business, we can take care of ourselves. It's not true. There must be national, international collaboration, allow NGOs, multinational corporations.
Agencies.
Yes, and that is what I read about the partnership between CDC Africa and MasterCard Foundation. And to read about $1.5 billion are willing to invest in the supply and vaccination of our people during the COVID, and even extend that to go into vaccine production towards the future it's a wonderful collaborative effort.
Absolutely. And of course, you're talking about the Saving Lives and Livelihoods Initiative,
Saving Lives and Livelihoods.
SLL, by the MasterCard Foundation and Africa CDC. And even more of those, maybe you could also highlight some of the initiatives that also the AU has undertaken to drive the agenda on health security in Africa.
Yes, thank you. And as you speak, and as Reverend was speaking, I was thinking all this is like, can I say, an onion? You're peeling and
layers,
a layer. And for me, I'm now peeling it backwards in terms of this security. Yes, Reverend mentions national, but it starts off as a community.
Yes.
Then from the community, it now goes regional, countrywide, and then global.
Continental.
And remember, that's what we saw in COVID. COVID started off in 2019 in China. And my grandmother in the village, I mean, we could not relate that disease ever reaching the village somewhere in remote Kenya, but it did because we are a global village. So as much as we are building all these structures, we should look inwardly, but also look globally. And it's fantastic to see all these initiatives, not just by local leaders or local governments or national governments, but African initiatives, African-led, and not just Africa alone, but global. And it's fantastic to note of MasterCard Foundation, Africa CDC, and they really changed the landscape when it came to vaccines and many others that have saved lives and livelihoods. But then also there are other initiatives. I'm involved in one of them that is known as the African Pathogen Genomic Initiative, where we want to be at the forefront of detecting any new pathogens. And quickly, once we detect, there's a sequence, because we want to make sure we have that genetic sequence, because there's a scientist seated somewhere in Seattle or Harvard who can quickly take that sequence and start formulating a vaccine. Because as I mentioned, we are a global village. So having that initiative here in Africa, being African driven, we can for the first time start sequencing some of our pathogens. Remember, there's monkeypox, there's Lassa fever, and we need to be on top of these sequences, genetic sequences or genetic codes, so that a vaccine can be made very quickly in case of an outbreak. Then there are other initiatives as well in terms of supplying of vaccinations. And again, I've already mentioned the Africa CDC. There's also initiatives to start modeling an epidemiology, making sure that we can model a disease pattern. And one of that initiative is here in Kenya. It's known as SEMA, Center of Epidemiological Modeling. And here they're tasked together with collaboration with WHO, the African Union, to model a disease in case there's an outbreak. How is it going to affect a community or a country? And if it can affect the community, what are the numbers? And then finances. What do we need to make sure we can prevent? Do we have enough money? Do we have enough infrastructure? How is the healthcare to make sure that from that modeling, we can project what's going to happen, and there'll be a worst case scenario and a best case scenario. So we need all those structures in place to safeguard our health security. And there are many others, Gigi, but those are the 2 or 3 that really stand out for me.
Absolutely. And I'm actually happy that you're actually in one of those platforms, because I know how very passionate you are about these areas. You know, one of the biggest challenges we face in Africa is the equitable access to medical supplies. And among those platforms that were established by the African Union is the Africa Medical Supplies platform. What do you think should be the priority areas for this platform to focus on in order to accelerate promoting equitable access to medical supplies?
Well, for me, I think it should be well funded. We should be able to sit on the table with GSK or Gilead or other big pharmaceuticals to make sure that they are manufacturing the drugs that we need at the most affordable prices for our people. And then to make sure our warehouses are well stocked, so the supply chain should be also on top, and to make sure there's no shortages. And then also we need to talk about the cold chain. We have all these warehouses in the big cities, but how is it reaching that remote area? We saw, or I saw in the news, there's in Lesotho, there's a lady or some initiative where they ride up the mountains with a bike.
Yes.
But I'm thinking if she's riding up the mountain with a bike with a vaccine, some vaccines need to be in a fridge.
Need to be preserved.
Yes, so that they
Yes,
reach
yeah.
the population in the right way, in the most safe
The
way.
quality is not
Yes, so
sorted
how
as
is the
well.
cold
Yes,
chain?
yeah.
So as much as we have these medical supplies, there are many other smaller infrastructure that need to be
To support
well
that,
safeguarded
yeah.
to support this supply. So,
Yes.
I mean, it doesn't matter. You build for me the warehouse here in Nairobi, but the person who needs it the most is in somewhere so remote, somewhere in Somalia.
Yeah.
Okay, so how is it going to reach Somalia?
Absolutely.
So those are the questions we need to ask, make sure that as much as we have very good initiatives, we are all working together to make sure they're working.
Absolutely. You wanted
Yes,
to
I was
come in, Ravi?
also thinking that we could take advantage, or our people could take advantage of technology. You know, in this day, and you're talking about somebody taking the bike or riding on a horse, to go to the mountains. How about the drones? You know, and we're now on social media, on Zoom, virtual, can send information about anything. Why can't we explore that? And then we will be able to guarantee, our security.
Absolutely, absolutely. Thank you very much for that. On the other side of this, I want us to talk about what are the key collaborations, partnerships that are needed to drive this agenda forward, but also to address the deeper structural deficiencies that are currently impeding us from realizing our public health targets. But for now, we're going for a quick break where we'll hear what the people on the streets of Africa had to say. Stay tuned.
Ni muhimu mama na mtoto kuhudhuria clinic kutokana na ushauri wa madaktari. Alafu pia ni muhimu kwa mama na mtoto kupata lishe bora.
Deep in the villages, people die over simple stuff because health centers are a bit far from their homes, and most of them are ignorant about the health stuff. So every outbreak that comes in Uganda, they need to be educated more about that outbreak to overcome it, to take measures of preventing it. And what gives me hope is a number of people, let me say in crowded areas, now they have ideas about any outbreak that comes along.
With me, my significant impact that I have had, or COVID has had on me, is, taking me away from family and friends. Communication with neighbors around my community or wherever I live were a bit distant. So it gave me some sort of emotional trauma, or let me say emotional breakdowns, because I was left to live alone by myself, which on a normal daily basis, I don't, go about my daily life like that.
Welcome back. You are still watching Africa Health Check, and today we are discussing health security. We talked a bit more about what health security entails and what needs to happen and what has been happening at the global level or at the regional level. But I also want us to sort of like discuss what are the key recommendations, what needs to happen to sort of address the deeper structural deficiencies in our public health system that are still impeding us from realizing our universal health coverage targets. Dr. Marianne?
Yeah, Gigi, that's a very heavy laden question because there are many ways to look at it. Yes. And for me, I'd start off with policies. And I know the Africa Union or the Africa CDC has a very good public health policy. I don't know, you can maybe allude more to it.
Yes.
And for me, when I was looking at it and when I was hearing more about it, I felt like it's a roadmap. A roadmap that creates a framework on giving that protection, giving that foundation of good public health initiatives.
Yes.
So that once they're implemented, they are sustainable, long-lasting, and effective.
Yes.
So I'm hoping that we can implement that. And within this framework, we want to strengthen the communities. So very good community engagement, because we start there. I could be telling them about a disease, but I get blank faces. But if I go down there and I tell them about certain symptoms, if you observe certain symptoms, go to your healthcare, the nearest dispensary. For us, actually, we normally look out for fevers. Unexplained fevers are one of the telltale signs there could be an outbreak coming up. So are we educating our people about that? And then once we have that, so a very good community engagement, how are these hospitals? How are laboratories? And we've already mentioned one of the initiatives is to strengthen detection. And this has been led again by the African Union, the Africa CDC. So do we have enough well-equipped laboratories to detect that unexplained fever? What's causing it? Because the first thing they do is eliminate malaria, eliminate diarrhea or any other common diseases that make people get a fever. And if that's not there, then again, that's another tick. We could be dealing with an outbreak. So our labs need to be very, very efficient in detecting that. And then this lab needs to communicate. You can detect, but then who are you communicating to? So very good technology so that they can either write, email, call, or have a way to report.
Visualize.
Yes, to the next reporting structure so that it reaches the Africa CDC or WHO that we could be having a problem in a certain village. Once that is detected, so the response, what response will be put in place? So we have to make sure we are well funded to respond in terms of medication, in terms of hospitals, in terms of having oxygen in case these people now have symptoms of shortness of breath. And then also, are we training enough forces in terms of healthcare forces? Do you have enough doctors to take care of that population? Enough nurses? Are they talking to each other? So is there continuous education so that they're well versed to deal with outbreaks? So I could go on and on all those multi-layers. I don't know, Reverend.
She's talked about funding because funding is behind training. Funding is behind infrastructural development. Funding is behind supplies. But I will make specifically at this point, we need also to encourage local pharmaceutical production, because if Africa is going to rely on donor countries to supply our medications, we are not secure. But if we can encourage local pharmaceutical production of drugs for our needs, then we are in a good place.
Reverend, as much as that's a very good initiative to make sure that you're producing our own medication, it's such a huge task or tall order.
The mammoth task.
We are dealing with multinational companies that maybe want to safeguard their patents.
You know, with the funding, I don't know if you have
that?
to add to this. With the local funding, you talked about community. During the COVID, many countries, their leaders stood in front of the nation and appealed to them. And donor countries, banks, local, foreign, private, all kind of donated to them. They gave towards that. I think we can do the same if we really want to secure our health as Africa. Bring the community involved.
She's talking about the patents, though, right? Because there's also a lot of issues around intellectual property, the rights and ownership of some of this. So how do we address that? How do we mitigate that? Because from what I'm hearing, you're talking about domestic resource mobilization, which is possible to do. And we've seen with the COVID-19 response that domestic resource mobilization is not a problem with the right advocacy, right communication. But now what about accessing the rights to reproduce, to manufacture?
It's governmental collaboration. If we need it at the governmental level, country to country, group to group, they can do that. You know, just share patents. And then they can
talk about profits later. Because there's profit that so these companies want to make.
Dr. Miriam, how about traditional healers?
Indeed.
In Ghana, it's a big block. It's a developing block. They are accepted. They have certification. Government has recognized.
They're accredited.
Yes, and they have results as well. So talking about Africa health security, we don't want to leave them out, except that there is a monitoring. There is a body that certifies their operations. Then it becomes a blessing.
Yes.
Because some of those solutions are working and they've worked.
Yeah.
So,
Indigenous knowledge system have actually been infused
so in fact,
into
I would
a lot
want
of
them to be to patent their knowledge.
Yes.
Then we can now go to mass production of some of these solutions. There's this global problem known as the antimicrobial resistance. We are fast, we are seeing resistance to common-based antibiotics and other drugs. And maybe this way now we need to introduce our local resources, local traditional ways of healing and treating these infections. And then we'll be quite self-reliant.
No,
as
that's
Reverend
true.
has
That's true.
mentioned.
And you see, we're going back to the point on domestic resource mobilization, because the reason why a lot of this indigenous knowledge system is perhaps not well known or not well packaged is because of the issue of research and development. Not a lot has been invested into that research and development, packaging, and actually finding the value in our indigenous knowledge system. So I think it's, if we do that, and surely there are best practices around the patents issue, but I would love to see a lot of Africa medical solutions being patented and actually being used to save lives in our communities and not being shunned or looked down on as is currently the case.
You see, COVID has shifted our minds to communicable diseases, almost, to the neglect of non-communicable diseases, which actually are killing people a lot. Heart attacks, strokes, cancers, diabetes. So actually, even within the COVID, people with underlying conditions died quicker and died earlier. And she spoke about proper balance in the administration of healthcare within this era, post-COVID. So if we could make it clear to our policymakers that it is not all about transmissible, these communicable diseases. Let there be policy, let there be funding, let there be structures that are set up to deal with non-communicable diseases, as well as we're talking about, in a UHC inclusivity to all peoples of all kinds of problems. Let us do that. Otherwise, whilst we are taking care of, communicable diseases, we are manufacturing the vaccines, we are neglecting other major sides of the coin, which are also destroying people in the continent. I would love to see mammography, women checking their detection, being publicized, because cancer is killing people all around, cervical cancer and all those kind of things.
Men over 50 need to go for colon checks and prostate
cancer checkups.
So well-being.
The president of the Ghana Diabetic Association made a statement which hit my heart. She said, diabetes is killing more people than COVID. But COVID came and there was a fund for
but nobody wants to talk about that.
That's what we are talking about.
And of course, the framework that you're actually referring to earlier on is the one that was generated or launched by Africa CDC, and it's dubbed a new public health order for Africa. It was launched by CDC in 2021. And very interestingly, in our next episode of Africa Health Check, we'll be diving much deeper into it and sort of sharing with the public what it is about. So make sure you do not miss the next episode of Africa Health Check. Before we wrap up the show today, I would like us to take a look at our African Health Champion for this episode, and we highlight the young, enthusiastic, and entertaining Ndlovu Youth Choir from South Africa. Enjoy.
Amidst the pandemic's challenges, South Africa's Ndlovu Youth Choir emerged as a beacon of resilience. These young voices composed and shared a musical performance, translating vital health advice into various languages to reach diverse communities. Through their creative initiative, they transformed precautionary measures into captivating art, garnering global attention and spreading unity. Their journey from local to international stages, including American Idol, showcased the power of youthful determination in promoting health awareness. The Ndlovu Youth Choir became living proof that age is no barrier to making a significant impact, reminding us that unity and knowledge are crucial tools in overcoming adversity. The inspiration behind their graceful talent makes them our Africa Health champions for this episode.
Brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @AfricaHealthCheck. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.